Well, both of them will result in more government intervention, which will reduce the quality of health care and make everybody even more upset. And eventually, the answer to that will be a one-payer, universal, socialized medicine plan, which is what Obama has said he's favored. He's just doing this as a step in that direction. That's pretty clear. So, that's what they want, and that's what they're going to get if we allow them. Whereas there are many freedom-oriented solutions to the healthcare mess that would work. And one of the ones I talk about in Common Sense Revisited in the health section is the fact that we can increase the amount of medical practitioners that are available to the public. For now, and the example I give is in Europe. In Europe, the vast majority of people in Europe never see a doctor when they're giving birth. Most women do not go to doctors. They hire a midwife, and there's all kinds of options for them to hire midwives, and it's very competitive in the midwife industry. And they give births at home, and the cost of delivering is much, much lower, and the number of birth defects and birth problems and issues that come up are much lower than they are in this country. So there's a good example of what can happen if we increase competition, informed competition. Let people know, let nurses, let paramedics, let those people open up and hang their shingle and practice medicine. My mom was a nurse. She could do about 98% of what the people who came into the doctor's office did. She could do it herself. She didn't need the doctor, but for a very small percentage of the things that people came in for. Why pay a high-priced doctor for things that we really don't need to pay him for?
Absolutely, Clyde. I agree. As a matter of fact, one of my friends actually just delivered his baby in his own home.
Yeah,
so
well, I've done that too.
You get a midwife, and actually I was a emergency medical technician for 6 or 7 years. You learn how to deliver.
We're getting called for a break here. We'll come back to that in just a second, Jake. Hello, everyone. Thanks for joining us. Thanks for staying with us. This is Clyde Cleveland with Jake Towne from Pennsylvania, who's running for U.S. Congress. If you'd like to call and ask Jake a question, the number for call-ins is 800-313-9443. Again, that's 800-313-9443. And, Jake, you were just explaining about your experience as a medical practitioner. Is that correct?
Sure. I've never actually delivered a baby. What I was actually pointing out is that, what you had just mentioned, for instance, with pregnancy is like a midwife. That idea is actually probably pretty foreign to most Americans. But, like coming from China, it happens quite a bit. And also a friend actually, he lives right down the street. He just had his second, I believe it was his second son delivered by a midwife in his own home. Mm-hmm. And it's, those types of things are actually not all that difficult. Like I took a class back when I was in college about 8 or 9 years ago, and you took an exam to be an emergency medical technician, and you learn how to deliver a baby. And I've never actually delivered a baby, but it's actually not all that difficult. It's a very natural process, and it goes on all the time.
I guess people have been doing it for a long time, haven't they?
Yeah, well, you do have like a large increase in the demand for C-sections and that type of thing, and obviously that you need a hospital for. But,
but where is that demand coming from? I think that's really driven more from the medical profession than it is from the people. I mean, I'm very, very strongly against C-sections. It's absolutely essential. All 4 of my children I helped deliver. All 4 of my children, and all 6 of my grandchildren have been born at home. I think 5 of the 6, if not 6 of the 6, were born in the water tub. I don't know if you've heard about that or not, but my latest granddaughter, who's 10 months old now, was born in our living room. I assisted, and it was with a hot tub. And this is an amazing process with a midwife. The midwife was also a nurse. But our family has been doing this for a long time. We totally believe in natural birth and using midwives rather than wasting our money on medical doctors for the birth process. There are occasional situations that happen where you have to go to the hospital and you need a doctor, but if you really take good care of yourself, and that's part of a midwife's job, is to make sure that the mother knows how to take care of herself and how to be in good shape, so that when she delivers the baby, she has very little chance of anything going wrong. So, this is just one way. We got off on this, but it's just one example of ways where if we expand the amount of medical practitioners there are in business, we can lower costs. In other words, it's all about increasing competition, increasing freedom in the system, not reducing it. Whenever you get the government involved, it's going to reduce freedom. And so what we need is not the Republican plan, certainly not the Democratic plan. What we need is more freedom. And the libertarians have written, many libertarian have written very good medical care practitioners. Ron Paul's medical and health care policies and proposals are excellent. I've read your website on it. Very, very good ideas in there. But, the last thing we need is the government to get more involved in health care. I know you agree with that.
Yes, I do. There's one thing that I do believe that government has a role in establishing legal framework. And a lot of people have also brought up, and actually back to that chocolate candy store analogy, medical tort reform. And that's something that is actually kind of blocked from moving ahead because of these entrenched lobbies and that type of thing. But what a lot of people don't realize is that's actually medical tort reform and liability and contract law is the realm of the states. And we could also get into how healthcare is completely unconstitutional on the federal level, but
right.
On the state level, what one of the things that we do need to do is have put in place, like, people do need to have the ability to sue in case things are done incorrectly, like they plan to cut off, amputate your right arm, they take off the left arm instead, and that type of thing. But there needs to be, I guess, a lot more reasonableness introduced into the system. And when you have these 50 states, basically each of those becomes a laboratory, and the state that comes out with the best plan will tend to, over time, be copied by the rest of the states. So that's one thing that reduces it, and that looks at the lawsuits. But the other thing is, like, talk to any doctor, and what they'll tell you is, like, the cost of what they call defensive medicine is very high. And what defensive medicine is pretty much doctors needing to order tests, CAT scans, etc., that are very expensive, but they need to do it to cover their butt, so that they they aren't liable through their malpractice insurance. And the malpractice insurance for doctors is very, very high. I have a family member in the medical industry, and she's actually a PA, or a physician's assistant. And the main reason for that is she doesn't want to have to deal with, the malpractice insurance that can take up to a lot of your take-home pay.
Yes. Yeah. So those are the kind of reforms. And you're right. If we allowed it to happen at the state level and just completely got the federal government out of the healthcare issue completely, then we would have the states dealing with it, and we would have the right, some of the more freedom-oriented solutions that actually work to the benefit of the consumer. So that's good. We have a long segment coming up after this break, Jake, so we'll get into some of the other things. And I know you like to talk about the monetary system, and you're awesome in that area. So we'll be right back after this break and get into that issue as well. Don't go away.